It's my feel-good breakfast show.
Welcome back to this Tuesday morning on your Feel Good Breakfast show, Expresso on SABC3. It's time for medical chat with Dr. Darren Green, and today we're discussing the ability to move, the body's function that I think most of us take for granted until it starts failing. You know, as you grow older, those joints become painful, you become less functional, you're able to move less. This isn't all that possible anymore. So what exactly causes those kinds of aches and pains, and what can affect it? That's exactly what the doctor's here to answer. And of course, you can give us a call on 021-430-9881.
Yes. Well, doctor, as we love to do with these medical chats, let's back it up, go back to basics. What processes are involved when it comes to your mobility and your movement?
Yeah, it's basically, so we need to be able to walk, to shift our load from one place to another. So that's what it involves. Your body is adapted in amazing ways to shift weight from one area to another. And for that, you have specific designs in the pattern of movement. In other words, how you transfer weight, how certain muscles need to relax, others need to contract, to give you to get you into a place where you propel your body weight forward, swing your leg through, recoil and bend the knee as that weight's swinging through, then place pressure on the next foot, roll onto the ball of your foot, etc., etc. So it's incredible. But they're planned movements, and there's a lot of reflexive movement. If you think about full stride over there, in stilettos especially. But I mean, if you think about it, the brain is also involved in the process, because the brain controls which muscles contract, which relax. Also how to time and coordinate the movement. So a lot of people that don't do exercise or run when they're younger, for example, struggle with coords. We all say, I don't have coords. That's the synchronized movement of controlling finer nuances in the art of walking and movement.
Yeah, and you were just describing walking there. Like, let's not even get to running it, because
that's a different
a lot more complicated,
exactly.
a lot faster. So I guess the idea that walking is like controlled falling is out of the question. It's actually a coordinated movement all throughout. So let's say I were to get up from this couch to go to the kitchen. What kind of moves or sequences are involved in that?
Sure, so your brain would immediately already plan how much energy it needs to do that, and then put that energy aside in preparation for the movement, which is a learned movement that you've done 50,000 times.
Yes. Yeah.
You'll then position yourself for the best way of getting out of a chair. If your quads and your hip flexors are weak, you're going to rock out of the chair. You're going to lean back, and then you're going to use the momentum to lift yourself out of the chair. If your quads are nicely conditioned from all the squatting that you're doing, you're going to just be able to stand up.
Oh, look at the doctor with the squats. The doc's been doing the squats.
So, so it's about transferring that weight, obviously. So the process involves some mental planning and thinking. And then, obviously, that transfer, depending on how many times you've actually done it, can then take a pattern of transferring the weight, getting into a straight position where your posture keeps you upright, where you see the horizon and then can plan the first step of your movement. Problems come in, obviously, when you aren't planning the movement in a good sequence.
Oh, yes.
And you're not looking, for example, at your depth perception is out, even with your vision. And when you take your first step, whether it's too big or too small, can also lead to you tripping and falling.
Sure. So interesting how all these small movements can tell you, your quad muscles aren't strong enough.
Correct. Compensation.
Yes, the compensation. But Dr. Darren Green, how much of this is instinctive and how much has been learned from a young age?
From the moment you start moving weight around, from lying on your back as a baby to the place where you can actually sit unassisted, those spinal muscles and ligaments that are assisting your posture control and the ability to stay upright without falling over as a baby starts developing, which is essential for posture when you walk and move later on. To become an upright individual that can transfer weight, you need those phases. Then crawling, for example, teaches you how to gradually transfer weight onto the different joints and limbs, so that the joints can get used to shifting weight in a sequential manner. Thus, for example, a lady's push-up on your knees instead of on your feet. So you shorten the levers, for example, and the amount of weight you're transferring onto the wrists, the elbows, and so forth are then controlled. So you do that sequentially as a baby to a place where you get then to transfer more and more. Then you'll start standing up against furniture where you've got the full weight on your legs after, for example, 8 to 9 months.
Yeah. All right, well, we'll get back again with our chat with Dr. Darren Green. Of course, give us a call if you have any issues with mobility that you'd like to address. I want to ask the doctor a very tricky question. Since the brain has to tell the muscles what to do, so how quickly does the brain shoot its electricity to my finger if I'm doing this? Like, how quickly is that happening right now? Just think about that.
It's my feel-good breakfast show.
All right, we're back again with Dr. Darren Green in our medical chat. Today we're focusing on mobility, your body's ability to move around, help you balance, carry things around, and how it all works. And of course, you're welcome to give us a call with your questions or comments on the topic. And Dr. Darren Green will be glad to answer those. So sports and mobility, obviously very interlinked.
Yes.
Very interlinked,
Very much so.
especially when you think about reflexes. You were talking about earlier on about people that have
People that skip steps.
Yeah.
So, for example, you get some babies that don't crawl, they go straight from the sitting to the standing phase. Or you get, people that were in school that were never active in sport and now they're struggling to stay fit or to run properly. So, Dr. Darren Green, before you answer that, we actually have a caller online.
All right.
Craig, he's calling us. Craig from Johannesburg, good morning.
Good morning. How are you guys doing?
We're doing
Very
very
good,
well.
thanks.
What's your comment or question for Dr. Darren Green?
Doctor, I had a back operation about 6 to 7 years ago.
Yep.
And ever since then, I've been diagnosed as having what they call bone pain. I don't know if you've heard of that.
Yep.
And I am living constantly on anti-inflammatories. Is there anything I can do to try and get away from that?
How old are you, Craig?
I'm 48.
Okay, great. You sound a lot younger.
Thank you.
So in terms of his op, obviously you might have had a discectomy or a laminectomy or fusion.
I had a U device inserted.
Okay, so the question is, obviously why did he actually develop those problems? And in a young person, and he's considered to be quite young to have his first operation on his spine. The issue here, obviously, is using pain medication to survive every day. The anti-inflammatories are known with side effects, especially in the absence of having enough fluid. So if you are taking anti-inflammatories, big message to the public, please make sure that you're consuming enough water because it can damage your kidneys and cause gastritis, peptic ulcers, and so forth, gastric ulcers. That's the first thing. That aside, the things that are going to help someone that's gone through his path are going to be certainly a lot of lifestyle modification factors. That would include, obviously, looking at things like the equipment he's using when he does do activities, looking at his alignment issues. There's a team that needs to be involved with a patient like this, comprising from a podiatrist to a biokineticist that looks at the alignment of the feet, the pressure points of the feet, the arch supports, whether the arch is actually a low-set arch or flat feet, for example, and arranging that support in a way that doesn't affect the alignment of his hips and lower back. In that way, also, you need to strengthen the ligaments, or the muscles, rather, of posture, which would include things like Pilates, his abdominal core strength, etc. And then, obviously, the strength training of specific lower back muscles and the relationship to the hip flexors, etc., would also have to be looked at. So he needs a decent team to surround him in approaching the problem, not just from a drug or a medical point of view, but certainly a preventative and rehabilitatory point of view.
Okay.
Thank you very much for your call there, Craig. I was going to ask the question about the fact that a signal has to be sent from your brain to whatever muscle. So if you're doing this, or even better, when you're doing this, it happens pretty quickly. So what's the rate or speed at which signals are sent to your muscles from your brain?
So
and how does it all work?
different muscle fibers, different nerves, can conduct at electric speed. We speak about 300 milliseconds, basically, per stimulus or action potential. But, when it comes to things like a reflex, putting your hand on a hot plate, for example, that doesn't even involve the brain. The brain's not involved there. You've got a stimulus or a sensation that comes to the spine, up the arm to the spinal cord, and immediately it sends an impulse back called a reflex reaction to withdraw your hand. If you still have to think about it, you might end up with a second-degree burn. And then that too, like when you slip on a banana peel, for example, if your muscles are stretched too quickly compared to its normal activity, what the body often does is lock the muscle down and go into spasm to protect you when you're falling from snapping your spinal cord in half. So that's why we are so beautifully created, obviously, to actually withstand threat and to ensure survival.
That's incredible.
Very
Fascinating
interesting,
stuff.
yes. Well, I feel like I've left you open-ended with a question with regards to young age,
yes.
mobility. So we'll get to that question in a short while, but our lines are open if you'd love to give the good doc a call. It's 021-430-9881.
It's my feel-good breakfast show.
Welcome back. back to your Feel Good Breakfast show. We are still with Dr. Darren Green. Our lines are open as we talk about mobility, and perhaps you're struggling with it. And as we get older, your mobility becomes less functional. So our lines are open. That number is 021 4309881. We'd love to hear from you. But Dr. Darren Green, earlier I asked you a question before we got a call about how important it is to develop your mobility skills from a young age, from playing sport in school to crawling as a baby. How does that influence people that didn't do it as well compared
It
to
plays
those who did?
a massive role in your ability to coordinate finer movements. Now, some people think the ability of sport is all genetic, like big calves or small calves in families. There's a lot more to it than that. It's about laying down the pathways, the habit that forms in the hard wiring of the brain of taking a tennis ball, throwing it against the wall, firstly coordinating how far you need to throw it, how hard you need to throw it, so that it actually returns to you. Learning that skill and then catching it again, judging the speed as it travels through the air, deciding how tight or how loose you need to actually hold your hand so it doesn't bounce out of your hand, and close it at the right time. That movement is based on 50 to 100,000 times of doing the movement. And no child is going to get that right within two throws. It's all about the exposure early in your life, and the occupational therapists, the physiotherapists, and the biokineticists all will advocate teaching your child how to regulate muscle tone by doing certain things like jumping on a trampoline or a bouncy ball if they have naturally low tone, to maintain posture and help them focus even with the style of learning. So those patterns need to be hardwired. So your exposure as a parent and as a guardian should be to play a lot more with children in terms of motor function.
Yeah. Sure. Well, right now we've got a caller on the line. Vicky, you are live on Expresso. Go ahead.
Good morning, Doctor. How are you?
Great, thank you.
Doctor, my question is that my son was born with club feet, and he had 3 operations in each tendon.
Yeah.
And now he's 2.5 years old, still not walking. And now the family, obviously, looking at us big-eyed and everything. Is there anything that you think I can do to maybe help my boy?
Yes, so a good question. So for those that don't know, what club feet are involve an abnormal alignment of the foot where certain ligaments are subluxed and the foot actually then turns or twists in an abnormal position. So what you often have is after birth, the foot is actually placed in plaster of Paris in a more correcting position. So the degrees of club feet differ from obviously a grade 1 all the way through to more severe cases, and it would depend what grade this was in terms of the implements that get corrected. The person and the people involved here are your orthopedic surgeons that specialize in pediatrics, and they have a dedicated approach, obviously, where they change the increment and inclination of the foot according to a certain timeline, looking at the laxity of the ligaments and the alignment issues as well. So I think if you're in good hands in terms of seeing that specific specialist, I think that's where you should definitely continue. And certainly if you want a second opinion from a different specialist, always a good idea, just to make sure that you as a parent have looked at all sides of the equation, so that you don't struggle with guilt, because this is not something you've done to cause club feet. It's something that happens spontaneously. There's nothing that could have been done to prevent the club feet in the womb, and that's what's important for mom to know.
Excellent.
Okay.
All right,
Well,
thank you very much. Yeah.
Yes, we're going to be back with Doctor, and this time we're also going to talk about the weight, how your weight and obesity in South Africa can also impact your mobility. But if you've got a comment or a question, feel free to call us. Those lines are open. It's 021 430 9881.
It's my Feel Good Breakfast Show.
All right. Guess where we are? We're back again with Dr. Darren Green, Medical Tuesday chats, all about mobility. A lot of people are asking about osteoarthritis. Could you tell us about how that relates to our topic of movement today and how it is affected?
So arthritis is a really big topic, and it just means inflammation of the joint. Osteo referring obviously to the bone, and then arthritis, inflammation of the bone. Osteoarthritis comes about on the joint surfaces. We're looking at a knee now, and you can see the cartilage that lines the knee, for example, is affected. You have desiccation, which is drying out of the cartilage with some crack formation, but you also have with that the laying down. Because of the chronic inflammation, you have bony spikes developing, or spurts, and they call them osteophytes. And those basically form and cause sharp edges that actually can dig into the tendons, can irritate some of the soft tissue, and then give you swelling, redness, and pain. That's what osteoarthritis is. That's just one of the arthritises. I mean, you get rheumatoid arthritis, osteoarthritis, and then all the autoimmune arthritises, etc. But osteoarthritis, difficult because you need to treat it and deal with it in a way that's symptomatic relief until the joint needs to be replaced.
Okay.
So prevention is better than cure. Putting weight on your legs over time, keeping mobile from a young age to an old age, not having periods where when you do increase your body weight and become bigger or heavier, for example, you stop moving. That's when the joints become obviously less active, the blood supply is affected, and the cartilage can desiccate or dry out.
Okay. Well, doctor, we have another call
Sure.
caller on the line. Sharon, good morning.
Morning.
What's your comment or question for Dr. Darren Green?
Morning, everybody.
Morning.
I'd like to ask you, doctor, I'm losing feeling in my feet. I'm diabetic, so they say, but I'm not on insulin. I'm taking tablets, and I'm losing sensation, feeling in my feet. I'm not able to drive anymore because I can't coordinate my feet, and I have osteoarthritis. So is it the osteoarthritis or is it the nerves that are dying in my feet because of the diabetes?
Good question. So in this case, obviously, diabetes is known to give you a condition called peripheral neuropathy. So you've got a brain and a spinal cord, which are part of the central nervous system, and then you have the mesh of small nerves that go out to the periphery, called the peripheral nerves. And in diabetes, because of how the disease affects the blood vessels, your delivery of oxygen, nutrients, and sustaining substances to the nerve becomes affected. The nerve then starts having chronic changes to it because the blood supply to the nerve is affected. So it's a complication of diabetes to develop what's called peripheral neuropathy, and it could lead to really significant pain, allodynia, for example, and dysesthesias under the foot, where you walk on you step on a small stone and it feels like a thorn actually going through your feet. That can be modulated by good sugar control. So her sugar control needs to be immaculate, and then we modify the symptoms by treating her with certain drugs that help with nerve pain specifically. Things like Tegretol, carbamazepine, or amitriptyline. Lyrica is also known to help if she needs any help with that.
Okay.
Sure.
Well, Sharon, thank you for that call.
And there seems not to be enough time to just chat about this because it's so fascinating
It's a
finding
real
out about the
question,
human body. And so we always appreciate your time and expertise.
Thank you.
Dr.
Thank
Darren Green.
you.
Have a wonderful week.
Thank you.
And thanks
You too.
also to all our callers who contributed immensely to our topic.